Going on, good people? We are back. Let's talk about why black people don't trust providers, whether it's medical providers or mental health providers. So, I'm your boy James Harris, the founder of Mental Heal, which is a movement to get men back focused on overall wellness, their mental health as well as their physical health. And I'm also the author of a book, Man Just Express Yourself, which is an interactive planner guide for boys and men to better express themselves in various walks of life. You can get that book on Amazon, Target, Barnes and Nobles, Walmart, pretty much anywhere books are sold. And of course, yes, my website, mentalheal.com. Definitely appreciate you. I thank everybody who has purchased a copy, especially my fellow therapists who got this as a tool in their lobby or icebreaker tool. Fortunate. Thanks to all the spouses who got this book for their partners and doing these exercises over date night or dinner and stuff like that to exchange dialogue. And especially thanks to my parents who purchased this book for their young ones, the teenagers, so they can see if they still angered easily triggered and stuff like that, or see where they need room for improvement. So continue to support. I definitely appreciate you and thank you. And be sure to like, share, subscribe. This is helpful information. I'm loving the feedback that you guys are providing. So thank you. Submit me your questions, and I'll be sure to answer them during my segments as well. So speaking of questions, we got a question from a grad student. Let's see. I'm a second year grad student in the psych program. Are there any interventions to better assist or better treat the African American population? Um, so, to be honest with you, I presented 2 years in a row at ACA, which is the American Counselor Association. And last year presentation was how to treat African Americans, men and boys. You can definitely go to my YouTube and check out that video. But as far as interventions or techniques or modalities for that much, I'd much rather say you can use CBT, cognitive behavior therapy, and something else that I use is reality therapy, which is pretty much, based on the here and now approach, and it works phenomenal, especially with everything that's going on in the world, race related, COVID related, and stuff like that. You can address the issues that are surrounding. So check those two theories out. But if you want a more detailed, in-depth presentation, definitely stroll back on my YouTube and check out that presentation. All right, so if we're talking about why African Americans don't trust medical providers, it's personal biases that has been going on historically for a long time. In many cases, when African Americans go to the doctor, the same as a Caucasian or Asian or any other ethnicity, they tend to get treated much worse than those populations. And to be honest with you, historically, and I guess as far as the data is concerned, blacks are more likely to die sooner than any other ethnicity. Blacks are 3 times more likely to die by asthma than white people. Blacks have 25% higher cancer death rates than any other ethnicity. Black women are 20% have a 20% chance of having cancer as a death rate more than those white women. Blacks tend to have more chronic diseases in their earlier life and overall have a shorter lifespan or life expectancy. Let's not talk about the number one killer, which is heart disease. So it's different beliefs that come from different medical providers in different settings. I've heard several people tell me, or I've seen different studies where black people nerve endings are less sensitive than white people. So, they tend to get the needle poked in and forced and stuff like that. Or black people's skin is thicker than white people. Or, black people blood doesn't clot as faster. So, just different myths and stuff like that, which makes it uncomfortable to be seen by somebody who don't look like you, because it's like you getting, assaulted to get your blood taken and blood pressure screenings and stuff like that. So those things tend to happen whether you know it or not. So those are some of the reasons why black people tend not to trust providers. And then from a historical standpoint, medicine has been used to experiment on black bodies, without the consent whether it's to advance the medical field, which is cool, but you still should have some type of consent form or some type of study guidelines and ethical clauses and stuff like that. And which is another reason why this technique is hard, because it was used to reinforce like systems of oppression. Just using a black person without their will, without the family consent and stuff like that. It's so many different case studies as well with dead black bodies have been robbed from their graves, to study not only the anatomy but to experiment on different body parts and stuff like that, taking cells and stuff like that. And then from a psychiatric standpoint, it's so many different concepts of diagnoses within where we are overdiagnosed or misdiagnosed in so many different aspects. Like schizophrenia is one of them, ADHD is one of them. Depression is often overlooked in African American males because it, appears to be different, whether it's being irritable, anger, stuff like that, not just the common signs that the white women have. So some providers don't even know that. Like speaking of schizophrenia, they tend to assume that black people are hostile, violent, and stuff like that, or just paranoid within that, so those be the status quo labels that they give them. And also, while we're on history and false diagnoses within the mental health side of things, it was something called Drapetomania, which is a runaway slave syndrome. Yes, it was a created diagnosis that was given to African slaves, who fled their slave owners. So if you don't believe me, just look it up. So it's Drapetomania. It was a movement by a physician by the name of Samuel Cartwright. His hypothesis was enslaved Africans fleeing from captivity were insane. They were crazy. So runaway slave was crazy, and of course the mania piece to it. So they weren't leaving because they were abused or they were put to death or they was raped nonstop and they had to work and stuff like that. They were crazy. That's why they were fleeing. So Drapetomania, is pretty much the concept that has been debunked and classified as a pseudoscience, and it's also part of like this pointless system of scientific racism. So if you're not familiar with pseudoscience, that's pretty much is like a contradiction or unfalsified claims of different theories and stuff like that, different hypotheses and stuff like that. So the reliance on confirmation bias rather than rigorous attempt to refute different studies, the lack of expression by evaluating different experts within the field had the same type of theory. That's not the case. So with the pseudoscience, it's pretty much absence of systematic practices when developing a hypothesis. So it's pretty much somebody just labeling or saying that they are doing different studies and stuff like that. And it's pretty much an experiment that's been discredited. And as far as scientific racism, that's a belief that empirical evidence exists to support or justify racism, whether that's racial inferiority or racial superiority. But either way, again, Drapetomania has been like cast away, by different medical providers as well as mental health experts within the field. So luckily for that, but it's just wow. So moving forward though, another reason why African Americans don't trust the healthcare system, whether it's mental health or physical health, just think about the infant mortality rate, especially among our black women and stuff like that. 22,000 babies died before their first birthday in 27, and a little bit higher than that in 2018 up to 2020. 5.9 infant deaths per 1,000 births, according to a new report by the CDC. So you can also look these information up that I'm giving you as well. So the infant mortality rate among black babies was 10.97 in 2020, which was not that far long ago. More than twice that rate among white women, Asian women, Hispanic women. And speaking of white, Hispanic, and Asian women, their numbers were like 4.67, 3.78, 5.1. And, but getting a little bit higher back to those other minorities, I guess, like the Alaskan Natives and the, those other smaller ethnicities or considered by, to be people of color. Another socioeconomic status play a part. The availability to access quality health care has played a part. Nutrition, food can be, effect on the baby's health. Public health experts, disparities in infant death rates often reflect border inequalities. So, of course, it's a difference between seeing a provider who is willing to help you or just, again, experiment on you and stuff like that. That's why a lot of now, moving forward, I know specifically in my area, and I see on social media and stuff like that, more and more black women are now having home births or getting doulas and stuff like that, which is fortunate. And the numbers are starting to decrease. Hopefully they overall continue to decrease and stuff like that. But black women were more than 3 times likely to die from preterm birth-related issues as a baby was born than white women in 2020. So those things definitely put the fear in people to not want to see a provider. Just the structure of a healthcare system. The healthcare system itself is a system. So many systems have, of course, systemic racism or institutional racism. And I'm not saying every provider or every doctor or mental health expert, have these things. But, of course, it is a difference based on the data how African Americans are treated, which can leave some women without access to prenatal or postpartum care. If we're getting back to the infant mortality rate, racism within the healthcare, it can be conscious or it can be unconscious, just like pretty much any other institution. More women with healthcare problems, chronic health issues, heart disease, can lead to pregnancy complications and stuff like that. So if a woman don't have access, whether she's black or any other ethnicity, then there are going to be some complications. But historically speaking, the African American woman, the black woman, has less access and availability to certain things, whether that's prenatal care, whether that's postnatal care, or whether that's just care and support throughout her pregnancy. There's also a lack of awareness of the signs of trouble among women providers. So these things can definitely be a hindrance. But I think another thing that contributes to the reasons why African Americans, black people, don't want to go to providers or hospitals and stuff like that is, of course, because cultural competence. So it's a lack of diversity in the field and across the board in many aspects, whether that's physical health or whether that's mental health. So whether that's breaking down the divisions of race, ethnicity, cultural competence, cultural diversity and stuff like that within the United States, all of that's important. Cultural competence is a set of congruent behaviors and attitudes and policies that come together in a system for professionals to enable effectively work like cross-cultural situations. Like you understand aspects of different cultures. You're not of that culture or that subculture, but you are doing your due diligence and research and stuff like that. And this can be beneficial with building a relationship and a rapport, of course, with your clients and trying to understand and taking an extra step to see if it's something else that you may have overlooked when you are providing a diagnosis, when you are treating them or collecting samples from them and stuff like that, or just hearing that overall story. Cultural competence definitely play a part. Those things definitely make the system, slowly decrease and stuff like that, especially if you got thoughts of Drapetomania and, trying to experiment on, putting blood and stuff like that. So it's different principles that you can do to build your cultural competence. Pretty much, understanding culture, just research who you are working on or try to obtain education on that, and definitely you want to value the client's beliefs and they believe them when they tell you like something don't feel right or they having these certain issues and stuff like that, opposed to brushing it off and assuming that they can tolerate different pain or if it's on the mental health side, they are not dealing with certain diagnoses and stuff like that. So recognize the complexity in different relationships, based on that relationship, whether it's doctor-patient or whether it's therapist-client, whatever your dynamic is in that situation. Facilitate different learning between providers and the community. So it might take American Heart Association to come do a presentation on heart disease, or somebody come do a presentation on diabetes and stuff like that. And on the mental health side, somebody to come in and talk about how stress can contribute to those things, or just break and debunk those issues of getting people to therapy, specifically Black people to therapy, or to any other medical provider, or bring in somebody to talk about how there are disparities within the infant mortality rate among Black women. But hey, here's what we're trying to do to combat that. Just provide resources and stuff like that. All of that can assist with cultural competence and build the relationship and allyship among the community. Collaborate with others if you need to. So definitely reach out to me. Let me know your thoughts. Drop a comment below on different reasons why African American Black people don't like going to medical providers, mental health providers, and or physical health providers. I purposely didn't get into the Tuskegee experiment, one, because a lot of people don't understand it and don't know what happened, what took place, and they're misinformed on it. So I want you guys to do your research, and I also want you to add other comments below of why African Americans don't like or don't go to different providers. So definitely appreciate you. Make sure you like, share, comment. Catch me next time.